Good evening all. I'm Madhvi, counselor from Oasis Fertility Secunderabad. Today we have come for the FB Live from Oasis Fertility with Dr. Parinaaz Parhar as our clinical head. So Oasis Fertility is #1 hospital in Hyderabad providing all advanced techniques and fertility treatments like IUI, IVF, PGD and PGDS. So today we are going to discuss few commonly asked questions by our patients. So Dr. Parinaaz Parhar, please, madam, over to you.
Hello, everyone. So we are seeing a rise in the number of infertility cases, and there are some very frequently asked questions when patients come to us for treatment. There are some questions which we find them repeatedly asking us, and today, by the medium of this FP Live, we are really looking at answering these questions. So what we're really going to be doing here is that Madhvi is going to be throwing light on some questions which patients commonly ask her, and I'll try and answer them as briefly as possible for you all, so that we can answer all their doubts as elaborately as possible. Yeah.
Okay. So the first question goes like, what are the chances of success rate for IVF?
See, this answer to this question is not as simple as the question itself. So if you ask me what is the success rate of IVF, it depends on a number of factors. But in general, you can say that in the best case scenario, it would be about 45 to 50%. When I say best case scenario, it's for the younger population where the female's age is, say, about less than 35 years. But as the maternal age increases, there is a slight decrease in the IVF success rate as the mother's age keeps on increasing. The success rate would depend upon what is the cause for your infertility, what is your ovarian reserve, what is the maternal age, for how long you have been married, what is the sperm parameters like, have you had any previous IVF failures, and it would also depend on what is the quality of the embryos that we have. But in general, if I were to quote, in the best case scenarios, it would be about 25 to 50% for IVF. Another important terminology which is there is something which is known as the cumulative success rate. That really talks about from one stimulation cycle, what is the maximum results that we can expect. So in order to improve the success rate, what is really advisable is that we try and get as many embryos as possible from the first stimulation itself. So yeah, just to put it in one line, if you were to ask me, you can say that it's about 45 to 50% for IVF. Amongst all the treatment options which are available, IVF would have the best chances. If we were to further try and improve the chances of IVF, then we can use some advanced techniques like ERA and PGTA to try and improve it to about, say, about 60 to 70% in special cases. But let's not be fooled into thinking that, IVF is something which is going to guarantee you a 100% success rate. That's something which we make very clear to our patients. Please don't come with that kind of impression that IVF means guarantee hai, pregnancy to honi hi hai. What can be assured is 100% effort and the best treatment, but the success rate on an average is about 50%, 45 to 50. It would also depend upon whether self-oocytes are used, donor gametes are used. So there are a lot of factors which really determine and decide what is going to be your IVF success rate. Yeah.
Thank you, doctor. So the next one commonly asked question is like, how can I try and improve the chances of success?
So see, that is just to try. It's everyone's goal to try and give you the optimum result in IVF to make your first attempt the best. So just to try and optimize your results, we have something which is called as the pre-treatment phase, where the patient is basically started on all sorts of medicines in order to improve the quality of the eggs, to improve the number of oocytes which we retrieve, to improve the sperm quality. So during this phase, when you're really preparing for your IVF cycle, besides really taking all the medicines which your doctor has prescribed to you, things which you can do to try and improve your success rate is probably you can, if you're someone who's on the heavier side, who is on the heftier side, where the BMI is more than 25, losing a couple of kgs would really help. It's important to remember here that we're not asking you to go in for a crash diet or something, because that is an added stress on the body, which is just going to throw your hormones all over the place. So what we're really advising is that you adopt a healthy lifestyle. So you try and include some exercise in your lifestyle. If you can't exercise, at least try and walk as much as you can, avoid the stairs, drink as much water, eat healthy. All these things are going to contribute in small ways to try and improve your general health and the quality of your gametes in general. Also, what you can try to do is that if you're someone who is suffering from some pre-existing comorbidities like diabetes, hypertension, or if you're suffering from any other issues, it's best that while you're preparing for your IVF treatment, you try to get these things in control as well. Especially for patients who are diabetic, it's very important that your HbA1c is less than 6.5% before you're planning a pregnancy. For someone who is overweight, it's always better that you lose a couple of kgs before treatment, because it helps in improving the oocyte quality. It helps in improving your response to treatment. It would help in improving your chances of getting pregnant. And of course, your pregnancy would be much more healthier if you're in the normal weight range. Now, this was about your physical health, but at the same time, any sort of fertility treatment tends to be a kind of a stressful experience because of the expectations you have from it. So it's also important to pay attention to your mental health. So definitely indulging in some sort of yoga and things which kind of activities which kind of reduce your stress levels is to be encouraged. So yeah, these are the things which you can try and do besides having your medications on time to try and improve your outcome. Get enough sleep, try to be as stress-free as possible, and just follow your doctor's instructions. Yeah.
Thank you, doctor. So the next one is, how long does it take to complete the IVF treatment?
Okay, now this is a very good question, because a lot of people come with this kind of expectation ki, okay, IVF, we'll start it, and by the end of the month, definitely we'll be pregnant and we can plan our lives accordingly. It's not that way. So like I was talking, there's going to be a pre-treatment phase, then there's going to be a treatment phase. The pre-treatment phase is when we are trying to optimize your cycle results. So that is usually about, say, 15 to 30 days. We usually tend to do hysteroscopy and put you on some medicines in order to try and see if there's anything which we can do in order to improve your success rate. Besides doing all this, we would also then move on to the treatment cycle. So the pre-treatment phase is about anywhere ranging between 15 to 30 days. It can be more for some patients where we are looking at improving that, where we want the patient to lose a couple of kgs before going for the treatment, or we are giving them some medications to improve their, their gamete quality, or if the husband is undergoing some treatment to improve his sperm quality. So pre-treatment is basically preparing for your IVF stimulation, and it can range in duration from approximately 1 to 3 months also at times. Then comes to the main stimulation phase. Stimulation phase is when we are actually giving you injections in order to make your oocytes grow. So the average duration of this phase is about 10 to 15 days. And it involves giving you daily injections. And you would be called in between to undergo scans to see your response to the therapy. After that, you undergo an egg retrieval, for which you're just admitted in the hospital for half a day. And under anesthesia, your oocytes are retrieved. Then they're combined with your partner's sperms. And we start growing the embryos in the laboratory. Now, we at Oasis usually tend to freeze at day 5, at least grow the embryos till day 5. Most of the patients undergo frozen embryo transfer. Very few with us which usually undergo fresh transfer. So if you're undergoing a fresh transfer, you would have the transfer of the embryos done within about 5 days after your pickup, and 2 weeks later, you would have a blood beta HCG test done in order to determine whether you are pregnant or not. Now, this is the shortest cycle. So if you are supposed to say that how early can I conceive, what is the earliest that I can conceive with IVF? Well, if you are not even undergoing pre-treatment, approximately 1 month, but that's very few patients where we really do that, because we want to optimize your results and give you pre-treatment initially. Now, in case if you're not undergoing a fresh transfer, most of the patients undergo frozen embryo transfer. So in these patients, post oocyte retrieval, we don't transfer the embryos directly. We freeze them either on day 3 or day 5. Then we give the patient a gap of about 15 days to 1 month in order to let their ovaries recover or reduce the swelling of the uterus. And after that, we do the transfer. Now, The transfer, if we are doing a frozen embryo transfer, that would involve another month being spent, approximately about 15 to 20 days being taken to develop your endometrial thickness before the transfer is done. And once the embryo transfer is done, the pregnancy test can be conducted about 2 weeks later. So the earliest that you can get conceived with IVF without any pre-treatment would be within a month. But the average duration, if you were to ask me, if you want to follow proper pre-treatment stimulation and a frozen embryo transfer cycle, you should take about 3 months on an average. Yeah.
Thank you, doctor. So the next question is something related to that. Like many working women ask these questions. Like, do I need to stop working during IVF treatments as I've been told to be on a complete bed rest?
Yeah, that's another very commonly asked question. And in fact, people want to plan their cycles around their vacation time or holiday season because they don't, that would allow them bed rest. But it's not important. It's not mandatory that you have to go for bed rest post your transfer. Absolutely not. In fact, I would encourage you to continue with your normal lifestyle, with your normal working and everything, as long as you're not it's not very stressful, as long as you're not putting a lot of strain on your lower abdomen, it's not involving a lot of physical exertion. As long as your daily activities don't involve that, you can do small, light household works or desk job is easily doable even post-transfer. So no, bed rest, complete bed rest is absolutely not required post-embryo transfer or post-IVF. Immediately post-oocyte retrieval, if you're someone who's had bulky ovaries, if you've had a good number of eggs retrieved, well, in these patients, we would advise you to reduce the kind of strain you put on your lower abdomen and avoid lifting heavy weights for a couple of days. But then again, you don't need to sit at home. And similarly for embryo transfer also, you can go about your daily activities. No need for bed rest then. Yeah.
Thank you, doctor. Then the next question is, are there any side effects for IVF treatments?
Okay, the side effects for IVF treatment, there's nothing major as such. Besides, yes, the injections can be painful based on your pain threshold. There are some patients who just take it in a stride and the others who would be really troubled by it. But most of them are subcutaneous, so it's like fairly bearable. There would be an odd patient who would complain of, like some mood swings because these are hormonal injections, and someone might get a slight headache and all. But besides these minor side effects, if you're talking about any major side effect, there used to be, if I can say, a very dreaded complication, which was ovarian hyperstimulation. But nowadays, with the medicines which we have literally moved on to ovarian hyperstimulation free clinics, where we have protocols like antagonist protocols and all, which literally have reduced the incidence to OHSs to negligible. So yes, fortunately, I have not seen, thank God, and I hope to maintain that record. I haven't seen that complication because of the kind of protocols we have now. So nowadays, IVF drugs are fairly safe. The therapy is fairly comfortable. Another complication, if you may call so, is of multiple gestation. A lot of people, in fact, would think that, if you're undergoing IVF treatment, it means 2-3 babies at a time. So that used to be more commonly faced problem earlier, where we knew less about how everything worked, and we would have doctors putting in more embryos in order to try and improve the success rate. But now, as we are more confident about our technology and about the way things work, we are slowly shifting towards single embryo transfer. And towards day 5 blastocyst transfer. So we have seen a significant reduction in the risk of even multiple pregnancies. So that's another thing which is fairly well taken care of nowadays. A third thing, which is a complication which I really warn my patients about, is torsion. Torsion of the ovaries is when your ovaries twist on themselves. So during stimulation, we tend to give the patient injections for about 10-12 days, and the ovaries become bulky because of the number of eggs which are growing. So it's imperative that you take enough care that during the stimulation and immediately post pickup, especially until you get your periods, you don't do any kind of activity which puts a sudden strain on your lower abdomen. Don't lift anything heavy. Take it easy on yourself. Drink a lot of water, because the ovary is attached to your body by a thin stalk. If you do any sudden activity, it's just going to move turn on itself, and that leads to severe acute abdominal pain. It's so bad that it needs a emergency surgery in order to detox the ovaries. So that's a complication which we really want to avoid. So yeah, these are some of the complications and side effects, if you might say, with IVF.
Okay. Thank you, doctor. So one thing, like the next question is that there are many patients who ask that whether cesarean is compulsory. Cesarean is compulsory for IVF treatment. That is what they get.
I had a patient ask me this question right this afternoon. So, no, cesarean IVF per se is not an indication for a cesarean section, but I would agree that almost 90% of the IVF patients undergo a cesarean section for delivery. The simple reason being that it's a precious pregnancy. So, most of the obstetricians would tend to try and reduce the risk of any complication which might happen in the 24 hours, 18 to 24 hours duration of labor, and rather post the patient directly for an elective cesarean section under controlled conditions. So that's what tends to happen. But as such, IVF is not an indication for cesarean section. The only reason why most of the patients undergo is because it's a precious pregnancy. Also, sometimes what happens, most of the times, IVF patients, the patients who need IVF are those who have some sort of existing comorbidities, or those ladies who have advanced maternal age. So they have some coexisting conditions like hypertension, diabetes, and other indications for cesarean section, because of which they are taken up that way. But no, IVF patients can undergo normal delivery if everything else is fine. So yeah, I hope I've answered that question.
Yes, thank you.
It's basically what your doctor is comfortable with, what she feels, what your obstetrician feels is best for you and your baby at that time. Yeah.
So I hope all the patients who are viewing this have definitely got their answers in this view, as our doctor has cleared all your queries. So the next question is, again, it is related something to like whether it is a twin or a single baby, madam. So they ask me, like, does IVF always result in twins? What if I want a single baby?
Yeah.
Because we generally say that two embryos will be transferred at a time. So the first question, what they get their doubt in their mind is like, what happens if twins happens? Like,
Yeah, I know patients who come for IVF, you have basically two types. There's one who is like, just give me the success. And there's another one who's like, give me specifically one baby at a time. So, like I was saying, now we're more sure about what we are doing. So, we have moved from day 3 transfers to day 5 transfers, where we're doing blastocyst transfers on the 5th day of the embryo's life. And because we are more sure of the quality of the embryos when we're doing a blastocyst transfer, we are slowly progressing towards a single embryo transfer when we're sure that the embryo quality is good. If there is a patient who has a good quality embryo, and if she's someone who's less than 35, 37 years old, a single embryo transfer can very much still give you a success rate of 40 to 50%. And that is the best assurance against multiple pregnancy. So if you're someone who just wants one baby at a time, single embryo transfer, single embryo day 5 blastocyst transfer is the best option for you. And that's the way we tend to bring down the multiple pregnancy rate. So if you want one baby, you can still just have one baby at a time with IVF. And I would say I would rather encourage that rather than having twins, because like we all know, twins is a slightly high risk pregnancy as compared to a single, and it's easier to manage one baby at a time. Yeah.
okay, thank you, doctor. In the next question is like, I'm 38 years old. Till what age can I undergo IVF treatment, and what is the time you have suggested between each cycle?
Okay. So there are some regulations by there are some laws of the land, especially after we had a couple of cases where even very senior citizens were undergoing infertility treatment in order to have, like have babies very late in their life. So now the ICMR has become very strict. They are very strict. SR and all our reproductive committees are very strict that the limit for ladies is about 45 and for men is about 50. So that's the age limit. There are some societies which are even quoting about 50 and 55 respectively. But if you're looking at using your own eggs, I would say up to 43, you can still try. It again depends upon what is your ovarian reserve. and how many eggs I see for you, what is your age, and what are the coexisting morbidities and everything. But yes, if you are a female and if you're trying for your, if you want to use your own eggs, I would say up to 43, 45 you can try. And let your doctor give you the best idea about what is your chance of success considering your ovarian reserve. Now, as like I was saying, as the age increases, the chance of pregnancy decreases, the quality of the eggs decreases, the number of eggs decreases. So, if you're looking at getting the same success rate as IVF would assure in someone who is less than 35, you might need to undergo more stimulations. You might need to undergo oocyte retrieval more than once. So yeah, now coming to the question about how much should be the time gap between each stimulation, it depends on what is really the time required for your ovary to recover. Nowadays, we are even moving towards double stimulation, which is an excellent option for patients who have less eggs and we want to get as many eggs out as possible, finish off with their, try to speed and accelerate their oocyte recovery and get as many eggs as possible before their reserve declines further. So in fact, we can even do start stimulating the patient about 5 days after their first pickup itself. So there is no real limit key. We have done a pickup this month, next month we can't do. Basically, the aim is that we have to see, the doctor will basically do a scan to see how many follicles do they see developing in the ovary and what is the hormone status of the patient, and accordingly they will take a call whether to take them up for double stimulation or whether the patient needs a month's time to recover, or there is some, if depending on what was the outcome in the first cycle, do we need, are there some things that we need to work on in order to improve the results the second time. So it all depends on that. There is no fixed answer to that how much time has to be there between each stimulation.
Okay. Thank you, doctor. Thank you. The next question is it advisable to undergo IVF treatment during summer?
Yeah, we're reaching summer now. A lot of patients come to us and yeah, please, we want to be done with it in winter because summer is coming. It's the other way around. I actually don't get. I am still to understand the basic logic behind why people are scared to undergo their IVF treatment in summer. I don't. I don't know. I really don't see the reason why we should be scared of. We are a tropical country and we have to deal with summer for most of the year. So, no, I think it's perfectly safe to undergo your treatment in summer because of the simple logic that your oocytes, your sperms, embryos, they're either stored in the lab in sub-zero conditions and we have 24-hour backup, or they are inside your body and your body is always around 37 degrees Celsius. So it's not that we're keeping your gametes outside. Plus the medicines which we use, they are always in the fridge. So the cold chain is 24 hours assured. So I really don't see why summer should make a difference to our outcomes. And we have actually done a research because of this common misconception. We've actually gone back to our case results and seen if we saw any fluctuation in the results according to the seasons. And actually there was no difference. So please be assured that IVF in summer is not really going to affect your outcome. The only thing I can possibly think of is that you might find it a bit difficult to kind of travel in the heat, but other than that, I don't see any reason. In fact, summers should be more convenient because most of the people would have summer vacations there, so you can take it easy and plan your cycle accordingly.
Okay, thank you, doctor. So next question is, if I need IVF for my first pregnancy, will I also need it for my second pregnancy? IVF treatment. That's what they ask.
Not important. Frankly speaking, I've seen a lot of, not a lot of, but I have seen a couple of my patients, very dear patients, who have conceived spontaneously post IVF treatment. It basically depends what was the reason, why did you need IVF in the first place? A very important cause for infertility, if I may say so, is stress related. A lot of people are so anxious, and this is the only reason I can find when I see them conceive naturally, spontaneously later. If you're someone who has problems like unexplained infertility, and nothing has really been found out, and you are taking treatment and still no success, these patients are the ones that once they have conceived once with IVF, you have taken off the stress of having a baby from them. They just spontaneously conceive the second time on their own. So if you have needed IVF treatment the first time, and if the reason was not something like blocked tubes or husband does not have sperms, then there is a chance. But if you're someone whose tubal delinking has been done, or husband is azoospermic, or you're someone who has uh, no ovarian reserve, so these patients, it's almost very unlikely that they would conceive on their own. But for others with unexplained infertility or those who have irregular cycles, you might just spontaneously conceive. And since we are talking about this topic, I would also like to mention that nowadays we are seeing a lot of patients coming to us where they have conceived spontaneously the first time, and the second time they need IVF. That also happens, especially when there's a long gap between your first and second child, because a lot can happen in that time. You might develop some tubal infection, or the husband's sperm parameters might just deteriorate, and of course your reserve also might have fallen down. So IVF once does not mean you will need IVF the second time. Similarly, natural pregnancy once does not mean that you are going to conceive naturally only the second time. Times change. Excuse me. Yeah.
Thank you, doctor. So the last question is, how is ICSI different from a test tube baby?
So, test tube baby was a very layman's term. It was just a terminology which was used to explain to the common man the whole. In fact, I think it even added a bit of a mystery to the whole thing about how these babies were born. Even when I was a kid, I would imagine a baby growing in a test tube. But if I am to carry forward on the same terminology, test tube baby is something which we refer to IVF babies. A slight modification of IVF would be ICSI. So ICSI is a modification of IVF. The whole procedure, entire way it's done is very similar to IVF. The only step where IVF and ICSI differ is in the laboratory. Once the egg is retrieved, in IVF, if the husband's sperm parameters are good, we can do IVF. If the sperm parameters are very bad, or if they've had previous reduced fertilization rate with IVF, then we prefer to do ICSI. So how do they differ? In IVF, we take one egg and we surround it with a couple of thousands of sperms, and we let the sperms enter the eggs themselves. Whereas what we do in ICSI is the embryologist takes one egg, sees it under high power magnification, selects one sperm for that egg. So out of the millions of sperms which are given, they select the one sperm which is looking motile and which has a good shape, normal shape. And that one sperm is picked up and one sperm is injected to the egg. The sperm which is best looking out of the whole thing, which is looking normal, is injected per egg. So yeah, that's the difference between IVF and ICSI, but a lot of clinics are doing predominantly ICSI nowadays. ICSI is more indicated for those patients where the husband's semen parameters are very poor, or if you've had a fertilization failure with IVF first. Yeah.
Thank you, doctor. Thank you. I hope all the patients who are viewing this have definitely, doctor has answered their queries. So thank you once again, doctor, for making the difference in your in the patient's life. Those you take care of. That's the thing.
Thank you, Madhvi. I think we have a couple of queries which have been raised by the viewers right now. Let's just take them.
Yes,
Okay. Okay, there's one about by Ms. Jen. Second IVF child success rate. Okay, if I'm getting your question right, you are planning a second child with IVF and you want to know the success rate. I hope I got that question right.
yes.
So now it can be two things. If you have some embryos which are frozen from your first stimulation, definitely they were frozen when you were a couple of years younger. So using those embryos now should give you a good success rate. But your success rate depends on your embryos and it depends on your endometrium. So if you don't have any problem with your endometrium, which might have developed with age, like any fibroids or any adenomyosis or any other issues with the endometrium, if you have embryos which were formed earlier during your first stimulation, can be used now, and if your lining is good, the second IVF success rate would be as good as what your IVF success rate was the first time. Because it is the quality of the embryos which would determine if your lining is good. Now, if your question, on the other hand, if you're talking about undergoing a second IVF and what is the success rate, it would depend on your age. and other coexisting factors. So it's very case specific. I would need your details and then probably I can guide you about that. Okay. If AMH is 0.6, what is the chance to get pregnancy? See, even if AMH is 0.05, you still have some hope, but we would have to see. It's very case specific. It depends. AMH of 0.6 at what age? If you're someone who's younger, you have a better chance of getting pregnant. AMH is one tool which can help us guide, but it does not tell me that you can get pregnant and you cannot get pregnant. So even someone with low reserve has a chance of getting pregnant. Yes, it would be slightly lower than others, but how do we improve your chance of getting pregnant? If you're we can improve your chance of getting pregnant by probably might need more than one cycle of stimulation to get the desired number of eggs as someone of your age. And if you're someone who's young, there is still a very good chance. So yeah, it again depends on your age and other factors, but I would encourage you to try and consult your doctor so that they can discuss the details. But I would say you still have a chance. Let's not sit over this value for long and just seek their help so that we can help you as soon as possible before it goes down any further. Okay. Now, there's a question about after taking COVID vaccination, can we take fertility treatment? Okay, so COVID vaccination is something which has really been introduced into the market at a very accelerated pace. Depends which one are you taking. I don't see any reason why we should really stop you from undergoing treatment, but see, that would depend upon when you have taken. At present, the contraindications for COVID vaccination would be someone who is pregnant and someone who is breastfeeding. So I think we can go ahead with the treatment. We are not very clear on this yet. We still need a lot of guidelines on that. But I think at least we can freeze your embryos for now. What is the success rate of IUB? Have we got the alphabets jumbled up? I think we have the sequence of alphabets wrong. I'm not getting the question here. Okay, I think that's about it. I hope I've answered all your questions and thank you for your patient hearing. Thanks a lot, Madhvi.
Thank you, ma'am. Thank you, doctor.
Thanks a lot.
Thank you.
Yeah, bye.